Hi, welcome to Family Service and Guidance Center's Ask a Child Therapist. My name is Karen Smothers. I'm the Director of Clinical Operations for Family Service and Guidance Center, and I'm happy to be here today to talk about how to take care of yourself as a parent. And as you know, people call in or ask questions by email or chat or phone in their questions, and today's question is a really good one, which is just simply, what is all this talk about self-care? I keep hearing and seeing the term self-care everywhere. It seems to have become really popular, but what does it really truly mean? I agree. Sometimes when we keep using a term over and over, I feel like, and when it gets very popularized, we start losing the meaning of what it really is about. And I have always thought of self-care as, especially as a parent, just taking a break, taking a breather, and trying to maybe in some ways escape the stress of being a parent when things get really hectic. But I heard a speaker recently, I was actually in a podcast, that talked about the difference between self-care and self-soothing. And this is something that really spoke to me. I had never thought of it in these terms and can see how it's very useful. So self-soothing is about, I just need something to comfort me in the moment. And maybe after a hard day of work, maybe after the kids are in bed, it's really about, I just want something to calm my nerves, or I deserve this. I feel a little entitled to it. In my case, it's maybe coming home and dealing with stress by eating a lot of carbohydrates, going through my pantry, looking for something sweet and something salty, and then just eating my feelings. And I realize that's not healthy. And there are sometimes I think I was referring to that as self-care. Like, I need to take care of myself. I'm just gonna eat whatever I want. For other people, that could be different things. It could be a glass of wine. I deserve this glass of wine. It's been a stressful day. The kids are driving me crazy. I need a break. But is self-soothing really self-care? And I think what I've learned is self-soothing is more in the moment, and it may be something that we want and is not necessarily something that's really caring for ourselves, our minds, and our bodies. And it really struck me when I was flossing my teeth, which is something that I really have to encourage myself to do because I don't want the dentist to lecture me about it. And I was flossing my teeth without being cajoled into doing it. And I realized, oh, this is self-care. It's something I'm doing because I know it's good for me. And I know in the long run, this is taking care of my health, my body, and what I need to do. So I guess I want to challenge all parents to think about, are you self-soothing or are you engaging in self-care when you're feeling stressed, or especially as a parent when you have those moments when you need a break? And so it is okay to self-soothe at times, unless this is a habit that's not very healthy. What we really need to focus on is taking care of our bodies and our minds so that we can be available to our children and give them our best self. So some ideas for you for self-care as a parent, and things I had to learn as a parent myself, is to first of all exercise. Get yourself 20 minutes of exercise if you can a day. That may mean taking a walk over work when maybe you don't have the kids with you. Maybe it's taking the kids with you for a walk. Try to engage in some kind of activity that will help clear your mind, that may distract you from thinking about all the things you have to do. And then being in the moment, being mindful, and being present with your kids or your family. So just a moment to think about, am I self-soothing or is this really self-care? It is important that we care for ourselves so that we can be present and there for others. Thank you.